Good day. My name is Michael Malondo, and I'm going to present on the subject of the HIV/AIDS Studies 1, HS10D1, which is for the first year degree level. My presentation is divided into two parts. The first part is going to look at practical guidance and guidelines that can actually assist you to prepare yourself for your examination. And then I'm going to give you some practical guidelines that you can look at and that you can also use before the examination and also during the examination. Then the second part of my presentation will then look at the content of the subject, where I'm going to look at the scope of the subject, but this does not mean this is the only themes that you have to look at. You are still required then to study the whole book, the whole chapter, the whole subject as part of your preparation for the examination. Now the first part is, these are only practical guidelines and experience I had and passed with students, and these are most of the things that students are doing, mistakes that are doing when they're going to write exam or prepare themselves for any exam. Now before you're going to write your exam, you need to give yourself at least 2 months time just to prepare. And as part of this preparation, you need to draw up what we call a timetable or a time schedule, where you will then say if your subject is 10 units or 10 chapters, you divide those 10 chapters now within the 2 months, or you can also make it 1 month. And the reason for that is you actually want to make sure that when you're going to prepare, you first want to make sure that you understand the subject. Now, there are 3 things that you have to do as part of your preparation and also within your timetable. The first thing is you have to read through the whole book, the whole study manual, the whole course. You have to know the whole module. You need to understand the content, you need to understand the context of the whole subject, because that will help you when you're going to write the exam. Because the mistake that most students are doing, that 1 week, 2 days before the exam, they want to start to memorize. So don't try to memorize the subject, understand the subject. Because when you're going to write the subject, it will be much easier for you to actually write or to answer the question because of the understanding that you have. Now, during the reading of your manual or your study guide, then secondly, you have to make notes. And the purpose of the notes is you want to identify those concepts and words or keywords that you don't understand. You can also go and look at the dictionary, you can also look at the library, and this is all part of you preparing yourself for the examination. And while you are reading, it's advisable that you have to make notes. Make enough notes, try to make notes, try to understand the subject, and if there are not words that you understand, if you have additional information from the internet or from other resources, write down those information, because these notes will actually help you during your revision and when you're going to revise for the examination. So after you've write the notes and you made your notes, whether it's on a book or in your study manual, then thirdly is you have to do revision. Now, revision is not memorization. It's not studying. It's not understanding. It only means that you are refreshing yourself, or you are refreshing your mind of what you already done 2 months ago or a month ago. Because your mind is a very powerful tool that you can use. It's like a computer. You store all the information on the hard drive. When you need the hard drive, you just retrieve the information from the hard drive and it will appear on your screen. This is how your brain is and how it works. So you will never forget it. Once you follow this principle of a timetable and then understanding notes and revision, then you will be sure that you will be ready at least 80 to 90% when you're going to have when you're going to write that subject. Now, during the examination, when you are going to get the exam paper, and all that you have is the exam paper, your script, and then a pen in front of you. So this is the time where you need to make sure that there are 4 things that you have to do. The first thing that you have to do before you even answer the question or write on the script is you first need to read through all the questions on your exam paper. And once you have read the exam paper and you know what the questions are, then secondly is you select the question that's easier to answer and that you know you will be able to answer very quickly. And then those that you don't answer can be then the last. Because remember, you only have 2 hours. Sometimes you only have 3 hours to answer this question. So it's very important for you that during the examination you have to make sure that you follow this guidelines. So you have read the question, you have selected the best question that you can answer, the easier ones. Then the third thing is what you have to do is you read again the selected question so that you can understand what the question is. And after you have selected and read again through the selected question, then fourthly is you have to answer the question. Don't interpret the question. Don't assume this is what the question is asking. Make sure that you answer the question that has been asked to you. So that's the first part of the presentation, and as you're going to use this, I hope that you will be ready then. So we are going now to go to the second part of the presentation, where we're going to look at the content of the subject. Now, this subject, by now I already assume that you read through your study guide, and I also assume that you've also watched my previous presentation. Now, this part of this presentation is it's only to help you, to assist you. It's only a guideline to help you what you need to do and how you have to prepare yourself. So there is a number of things that I'm going to go through as part of the examination scope. It does not mean that you only need to stick to this theme. It is still required from you as a student to read through the whole study guide or manual. So the first thing that we are going to look at is HIV prevention. Now, prevention is having different things different things that you have to look at when you look at prevention. Now, one of the things that people have to look at prevention is we are looking. Now, before I'm going to talk about prevention, we first need to look is what is HIV. So by now, I already assume that you know what is HIV and what is AIDS. It's two different things. HIV and what is AIDS. So go back to your notes, go back to your study guide to know the difference of the two. We don't want to prevent AIDS, we want to prevent HIV, the virus that can infect you. So there are 3 levels of prevention. There is the primary level of prevention, there is the secondary level of prevention, and there is also the tertiary prevention. But at this stage, we only have 2 types of prevention, which is the primary prevention and the secondary prevention. So in your preparation, I would like you to go and read up about primary prevention. There are different activities and different things that you can do during primary prevention. And in secondary prevention, there are also different things that you have to do. So it's important for you that you go to your study guide, you go to the library, and you can go and read again about prevention. Now, currently, so far, the 4 types of prevention that we have is what we call the A, B, C, and the D. Now, the A stands for abstinence, the B stands be faithful, the C stands for condom or protection, and the D stands for delay. So in your presentation or in your discussion on HIV prevention, you can also look into these 4 levels of prevention. And it's very important that when you're going to discuss the A, B, C, D principle, you can also go in details and also explain what it means. And how can it be applied? Does it work? Does it not work? And it's very important that while you're going to discuss this, you have to give some practical examples, for example. So if you talk about abstinence, what it means does to be abstinence. When you talk about faithfulness, which means you have to stick to one partner, you have multiple and concurrent partners. When you talk about C, you talk about condoms, you talk about protection, protecting yourself. And then D, of course, means that you need to delay for sex, waiting for the right partner. So these are some of the things that you can discuss. You can give some examples. You can look practically at all of those things, and also give some, as I said previously, some practical example what HIV prevention is and how it also works and how you can also apply it. Then we've got also another prevention strategy, which is circumcision. Now, circumcision is looking at male circumcision programs or male circumcision intervention, and the reason for intervention for the circumcision is only looking is how we can actually help men or young boys to assist them when it comes to infection or delayed infection for STI, which is sexual transmitted diseases, and for HIV. Now, circumcision does not prevent you from HIV infection. Remember that circumcision does not prevent you for HIV prevention, but it can assist you to delay HIV infection. So it does not mean that when you are circumcised that you cannot use protection. In fact, it will only help you not to get easily or to be susceptible for infection. So in your discussion, discuss the role of circumcision, and when it comes to HIV infection and also HIV reinfection, what role does circumcision play? And in your discussion, also discuss the issues or the factors of culture, tradition, and norms. You have some cultures in Namibia, for example, that practice circumcision. It's part of their culture. The moment a child is born or a young boy is born, you know that young boy is being circumcised and goes through a traditional circumcision process. Now, in your discussion, you can also look at other African countries in SADC, for example, South Africa, where they've also got traditional circumcision. You have in Botswana, you've got in Swaziland, for example, where they've got traditional circumcision. And then discuss, are those practices, those traditional practices, harmful, or can they assist? And if they are harmful, give some example of harmful circumcision practices or cultural practices. And then you can also look at other cultures where circumcision is a taboo, where it's not been practiced, where the foreskin of a male child, of a male genitals is considered as normal. So discuss those kind of things. Why do some cultures do not see circumcision as important? Then you can also explain the reason why. And then, of course, thirdly, then you have to look at why does the governments, like the government of Namibia, recommend and then also promote male circumcision. And then you can give some example what the process entails and how old must you be or how young must you be to be circumcised. And discuss these different issues and these different dynamics on circumcision. You have, for example, some cultures or some people that have this notion that the moment I am circumcised, I'm so immune for any infection. So discuss those kinds of misconception. So you discuss is the different kind of misconceptions that you have, or the taboos that you have, or the beliefs that you have about circumcision, and then also explain it against HIV infection or the HIV infection. So in your discussion, you have to give some practical example. Very, very important. Don't just, if the question is, for example, a 20-mark question, and you can get 20 marks. So writing a half a page will not help. So always make sure when it's a 20-mark page or 20 marks for the question, then at least write 1.5 pages or 2 pages, which will actually be very satisfactory to the person that's going to mark your paper. So as I say, circumcision is a very, very sensitive, also a very interesting, a very dynamic subject to discuss with, specifically in the culture of Namibia. We've got some of the cultural group that practice circumcision, but some of the cultural group, it's as I say, it's a taboo. So this is something that you can discuss in detail. Then HIV infection is not just the only infection that you can get. There are also kinds of what we call STIs, or sexual transmitted infection. So in your discussion, you first, or in your response, you first look at what is HIV. Then you explain but HIV is the mode of transmission of HIV, and also you can also look about the replica of HIV, the cycle of HIV, and then you look at sexual transmitted infection or sexual transmitted diseases. Explain what is STI, give example of STDs, and then compare the two. How does HIV and STD play a role? And remember, as I said earlier about circumcision. So if you have somebody that's been circumcised or not circumcised but is having unprotected sex, the chances for this person to become infected with HIV is very high. But what if there are also other STDs? And this is something that many people don't realize, that STIs are as important or as fatal just like HIV. Now, STI, we can look, there are some vaccine that you can use, there are some medication that can be helped with STI, but it's very important that you have to look at STI. What is STI? What contribute STI? What make STI and HIV more fatal? Now, there's a lot of ignorance when it comes to, especially young people that are engaged in risky behavior or sexual behavior, where they don't realize that STI can play a very important role, especially when it comes to male and both female. Then, of course, when you look at you discuss the whole HIV and STI, you also look, for an example, at the commercial sex workers, which are what we call the prostitutes. How are they susceptible or vulnerable when it comes to STDs and HIV? Discuss what are the challenges of sex workers, and what are the experiences of sex workers, and what makes sex workers more vulnerable for HIV and STI infection than those people or other people that are not sex workers. So discuss it. And in your discussion, you can also look at the legal framework of commercial sex work. You can look in Namibia, where sex workers, the whole issue of decriminalization of sex workers, or the destigmatization of sex workers. So these are some of the things that you can actually look at, how we can actually, and especially when you look at HIV prevention. Because remember, commercial sex workers or sex workers are high-risk groups. So they are actually high risk in the sense that they are very vulnerable, especially when it comes to safer sex negotiation. When a sex worker is having a client and the client wants to have unprotected sex for more money than what the sex worker is asking. So how do you discuss, or how does a sex worker handle such situation where a client, for example, who wants to pay a lot of money for unprotected sex, and that sex worker, and most of the time these commercial sex workers are mothers that are breastfeeding, or they are also having husbands, some of them are also having boyfriends. So they go back home and they are having unprotected sex with their boyfriend, and the boyfriend is also having other multiple and concurrent partnership. And as you can see, the network of HIV and STI infection just become bigger and bigger and bigger. So in your discussions, discuss this in detail, the role of sex workers and what impact it has. You can give other examples, for example, in Australia, in South Africa, where sex work is being legalized. How does it work? How is it being controlled? How is it being managed? Does it help with prevention? You can look at other countries like Amsterdam, like in Holland, Amsterdam, where all the red light districts are being legalized, where commercial sex work is legal. And as part of that legality, all the sex workers have to go through a periodic medical checkup where they've been checked up for STIs and HIV and so on. So this is something that you can also discuss or bring out in your discussions, and then give the example and then also the linkages of the HIV STI infection and the vulnerability of commercial sex work. Then the other aspect is then also caregivers, and I will encourage you to watch my previous presentation and then also go to the chapter on community home-based care. So caregivers only talk about home-based caregivers, and there is so much that caregivers can play. There is a very important role that any caregiver can play. And especially when it comes to a family setup where one of the family member is having a chronic disease or is chronically sick or bedridden. So what role does a caregiver play? And then also discuss the importance of caregivers. How important is caregiver? And then define who is a caregiver. Is it only those that are in the hospital that are giving palliative care for those cancer patients and so on? Or are caregivers also those within the family, within the friends? So this is something that you have to look at, especially when you discuss the role of caregivers. Then secondly, you have to discover also the challenges that caregivers are experiencing. For example, they are overworking themselves. They are burnt out. They are having fatigues. So how do caregivers handle all these challenges? And in your submission or your reply or feedback, you have to discuss in detail how the caregivers can actually cope with the challenges they are facing. And in many governments or many countries, we find that caregivers are not being recognized, or the role of caregivers are not being recognized. And remember that caregivers, they play a very important role, especially at the house or in a family setting, and they can play a much more bigger role than actually in a hospital or in a public medical setup. So this is something that you have to discuss in your feedback, giving practical example about caregivers. And then fourthly is you can also look at the public the policy, the caregivers policy, the national caregivers policy of Namibia. Look at the content of that policy, and how does that policy work? How does that policy regulate community caregivers? And having a policy, is it beneficial, or is it a disadvantage? Is it an advantage, or is it a disadvantage? Also discuss those very important things about the policy. Then also looking, as part of the policy, you will look at the legal framework. Is there any legal framework in Namibia that protects and regulates community caregivers? What do you do with where community caregivers' rights are being exploited, even their privacy? Because remember, caregivers play a very important role, and in many instances, a caregiver can be a confidant. And a confidant means that this patient is having confidence in this caregiver, and then share everything with the caregiver as much as possible. So discuss that in detail, and as I say, give practical examples. So when you look at the policy and the legal framework. And then of course the last thing, which is a very hot topic, is we can also look at the compensation of caregivers. If we say caregivers are volunteer, how are they being compensated? Because compensation is a token of appreciation. Many caregivers volunteer their time, they volunteer their privacy, they volunteer their comfort just to care for somebody that's a chronic or that's HIV positive. So also discuss this in detail as much as possible. And then, of course, when you are going to look at the issue of caregivers, it's very important that you're also going to look at the role of government and the role of different stakeholders. Because you have a government which is supposed to be the policymakers looking at caregivers. And then you've got the community-based organization of the civil society that's supposed to implement caregiving in Namibia. And then, of course, thirdly, you've got the private sector that's supposed to fund caregivers. Now, the question is, when we look at issues where somebody that's bedridden needs to be care of, you need to use different medical equipments or different materials. So what do a caregiver do in such a stage where there is no materials available to look after patient? What do you do? And also in your discussion, remember, don't just look in the urban settings in a town like Windhoek, Swakopmund, or Shakati, or any urban or city, but also focus on caregivers within the rural area, because many caregivers in the rural area are playing a very important role. And remember, in the rural area or rural settings, many of your medical facilities are very far. They are available, but they are not accessible. And sometimes, because of the distance, that many of these caregivers must play the role of a medical assistant, and sometimes also playing the role that's supposed to be played by somebody that's at the medical clinic or a public health service. So in your discussion, also discuss these challenges, looking at different settings, in the urban setting, city, and then also looking at the rural area, because the rural is mostly neglected, and this is something that you can also look at. So as I said earlier, the whole purpose of this presentation is not to repeat my previous presentation. This is not the subject itself. It's only the purpose of this presentation is only there to prepare you, to give you some guidelines, practical guidelines, what you have to look at, and it is still encouraged and expected from you as a student to read the whole subject, to have an understanding of the whole subject, and to make sure that you are ready. So I hope that this presentation was valuable, it helped you, and I wish you all the best with your examination. Thank you.